Hello everyone. Today I'm going to speak on the topic milestones of development. What is growth? Growth refers to an increase in the physical size by cell division and protein synthesis. The example for that is the weight and the height. So it can be considered as a quantitative change, whereas development is a progressive increase in the skill and ability to function. So it can be considered as a qualitative change. Coming to the principles of growth and development, there are two principles involved, that is the cephalocaudal principle and the proximo-distal development. So as the name suggests, the cephalocaudal principle, the development proceeds from the head upward to the leg downwards. Whereas for the proximo-distal development, development proceeds from the center of the body outwards. Generally, growth and development takes place in an orderly manner. So coming to the developmental domains, there is a gross motor, fine motor, language, and the cognitive domain. So the gross motor involves sitting, walking, and large muscular movements like jumping, whereas the fine motor consists of hand-eye coordination, working on small objects, and also problem solving. The language cognitive involves hearing, understanding, and the ability to use the languages. The cognitive domain includes getting along with people and caring for their personal needs. So these are the developmental domains. So coming to the stages of growth and development. There is the prenatal period and then there's the postnatal period. The prenatal period is subdivided into embryonic period and the fetal period. The embryonic period extends from the time of fusion of the sperm and egg to 10 weeks of age. The fetal period extends from 10 weeks until the birth. The postnatal period is again subdivided into neonatal period, infant period, toddler period, schooling period, preschool period, school period, and the adolescent period. The neonatal period extends from birth to 28 days. The infant period extends from birth to 1 year. The toddler period extends from 1 to 3 years. The preschool period from 3 to 6 years. The school period from 6 to 12 years. And the adolescent period from 12 to 19 years. So that is the stages of development divided into prenatal and the postnatal period. Coming to the prenatal developmental milestones. So the first 3 to 6 weeks of intrauterine life is when the major development of the face takes place. Then the 6th week, the deciduous tooth buds begin to appear. The 7th and the 8th week, the fusion of the palatal shells takes place. In the 14th week, the deciduous tooth buds begin to become calcified. And at birth, the permanent tooth buds begin to calcify. So the prenatal developmental milestones involve from the 3rd to 6th week, the major development of the face takes place. At the 6th week, the deciduous tooth buds appear. 7th and the 8th week, fusion of the palatal shells take place. If this fusion does not take place properly, it can result in a cleft palate. In the 14th week, the deciduous tooth buds begin to get calcified. And at birth, the permanent tooth buds begin to be calcified. Coming to the postnatal developmental milestones, let's see what happens at 6 months, 1 year, 1.5 years, 2, 3, and 4 years respectively. At 6 months of age, the movements that take place include the child will be able to sit without support for a short time. At 12 months, the child pulls up to stand. At 1.5 years, he will be able to walk without help. At 2 years, he will be able to kick a ball. At 3 years, he will be able to climb the wall. At 4 years, he can hop and stand on one foot up to 5 seconds. So these are the moments that take place. Let's see the noises that are produced. At 6 months, he can respond to sound by making sounds. At 12 months, he can respond when told no and says mama and dada. At 18 months, at 2 years, he can use 2 to 4 word phrases. At 3 years, he can use 4 to 5 word phrases. And at 4 years, he can use 5 to 6 word phrases. So these are some of the developmental milestones in the postnatal period. Coming to the craniofacial growth sites. So the cranium, the primary growth centers are the sutures and the synchondroses. At the midface, the sutures and the cartilaginous nasal septum are the growth sites. The mandible, the posterior surface of the ramus, and the condyle and the cornoid processes are the growth sites. You just need to remember the names. To the causes of developmental delays. There are prenatal causes or antenatal causes, the natal causes, and the postnatal causes. The prenatal causes includes torch infections like syphilis, gonorrhea. Then there could be chromosomal abnormalities. Brain defects can cause prenatal developmental defects, maternal alcoholism, and intrauterine ischemia. These are some of the antenatal causes. The natal causes include hypoxic ischemic encephalopathy, neonatal sepsis, and birth trauma. The postnatal causes includes cerebral palsy, autism, Kernicterus, nutritional disorders like rickets, and meningitis. So just need to remember some of the causes for postnatal developmental delay. So that concludes the presentation. Thank you.